Hello, my name is Rebecca Notestein, and this is my Nursing 335 clinical reflection. So, Objective 1 for Nursing 335 is utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. So, I did this with my experience through following the nurse practitioner Brian Weinberg, who was a nurse practitioner of bariatric and GI. So I used knowledge from Nursing 331 regarding diverticulitis, and I was able to comprehend and recognize the treatment plan for a specific patient that I had seen in Brian's office, and help him to establish a care plan for this patient. So I also accomplished this through my peer leadership clinical. So Nursing 309, I had assisted Professor Abril in teaching her students how to complete bed baths before they had went into the hospital. So I had used my knowledge from Nursing 309 to better assist these students with tips and tricks how to give good bed baths. So I actually let the students perform a quote-unquote bed bath, and I laid in the bed of the simulation lab and assisted them in gaining bed bath experience. So I also did this in Nursing 311 with Professor Wasson. So these students were learning how to do their head-to-toe assessment before they did it on their own for their end of the course final. So during this, I was giving them methods how to study for the head-to-toe assessment. I was giving them, for the cranial nerves, I said I used flashcards, and that really helped me remember the cranial nerves, and I could see that that was something that they were struggling with, as well as that was something that I struggled with, and I had watched them do their head-to-toe assessments, and I had given them pointers, don't forget to vocalize this, and don't forget to wash your hands before you go in, all of those really important tasks. So for Objective 2, apply the basic principles of ethics and management to meet the challenge of an ever-changing healthcare environment. So I accomplished this objective when I shadowed the nursing supervisor at Lehigh Valley Cedar Crest. So an ethical issue involving a nurse, a technician, and a few patients had arisen. The tech partner was upset with the patient care that the nurse was providing. And so the tech called the nursing supervisor, and the nurse supervisor and myself conducted patient interviews. So what the tech partner had said was that the nurse wasn't providing appropriate patient care. So she said that the nurse wasn't giving the patient the pain meds that they needed, wasn't assisting them to the bathroom. And it had turned out that this was all really a big misunderstanding, and that patient safety was evaluated, and it was evident that the nurse hadn't done anything wrong to jeopardize patient safety. The dispute was solved by reassigning the tech partner to a different assignment, and giving the nurse a different tech partner. So this experience encompassed Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. So this nursing supervisor kind of had to go into an awkward position where she had to reprimand this nurse for possibly jeopardizing patient safety, but she really put the patient first and kind of said, it's more important patient safety rather than jeopardizing this relationship with this nurse. So she really did a great job at handling that and putting the patient first. So this experience also encompassed course content of handling conflict. This conflict could have resulted in patient harm, so therefore the nurse supervisor needed to intervene immediately. In class, we kind of learned about how sometimes conflict can be let go, and you could kind of see if it resolves on its own rather than intervening right away. But this was a patient safety matter, so the nurse supervisor did intervene immediately. So for Objective 3, demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. So I think I did this really throughout every single clinical experience that I had, because communication is so important, and it was the very first impression that I had with these nurse leaders and my students as a leadership student. So I did this through introducing myself throughout all of my clinical experiences. Experiences such as peer leadership, I think it was a lot easier for me to introduce myself because I didn't feel that difference in power dynamic as I did in experiences such as following the nurse supervisor or following my advanced practice nurse. Those students really wanted me there, I felt like, and they wanted to gain more knowledge from me as a leadership student and as having been in their shoes before. This introduction and communication was a little bit more difficult during experiences with the nursing supervisor. So, I did kind of have to introduce myself to that nurse that was possibly being reprimanded. And that was a little bit of an uncomfortable situation for me, and I really think it helped me grow as a nurse leader. So I also did this through my experience with Brian Weinberg. So with Brian, I had to go in. The very first thing I did before Brian came in the room was go in and introduce myself to the patient. I said, "I'm Becky. I'm going to be working with Brian today. This is part of my leadership clinical as a nursing student at Cedar Crest College. Would it be okay with you if I sat in on your visit with Brian and kind of helped him with your treatment?" Brian Weinberg also helped me with this because I had to set up my own time and experience with him. So I had to reach out to him and say, "These are my available dates. What are your available dates?" And we kind of had to find a common time that we could both get together and I could shadow him. I also did this through sending Brian a thank you letter. So I kind of shared with him what I learned from him, and how it's really beneficial to Cedar Crest College nursing students to shadow people like him and gain our leadership skills. So objective 4, critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. So I did this through finding an article that I'll later discuss in post-conference. The article is entitled "Charge Nurse Perspectives on Frontline Leadership in Acute Care Environments." So this article acknowledges the critical responsibilities of a charge nurse in acute care settings. This article surveyed 353 charge nurses attending leadership classes. So the study had participants complete a pre- and post-educational survey. The survey showed charge nurses valued some very specific skills and qualities. They said communication was very important in their role because they had to communicate with the patients and the staff members. They also listed organization as an important quality to effectively lead a unit. These charge nurses said one of their most difficult roles was managing interpersonal conflict within the unit. Charge nurses also identified quality patient care as a difficult but important task. They said with the increasing demand of patients to nurse ratio that it was very difficult to provide the best possible patient care. So one of the highest motivators for these charge nurses was being able to develop and foster capabilities of their team members. So this can be classified as Sullivan's definition of transformational leadership. Sullivan says transformational leaders want to see their team succeed. Sullivan says this type of leadership also encourages interpersonal and team relationships. This study did find that organizations like to pull charge nurses and put them into nurse manager roles. However, the study found many charge nurses were not that interested in becoming nurse managers due to the decreased relationship with staff and patients, the lack of clinical skills, and the increased weekly hours that nurse managers have. So objective 5, function as a competent patient advocate, nurse advocate, and change agent. So this was really apparent to me when I had the clinical experience at the Lehigh County when I shadowed a prison nurse. So the prison nurse was going to be doing a physical assessment of an inmate who was complaining of arm pain. So when the prison mate had come up to the exam room, he was in shackles or what you would call handcuffs. And the nurse was kind of describing to me how some nurses might just keep the patient in handcuffs, but really for her to do a thorough assessment, she needed to have one of the shackles removed. So she really advocated for this patient and said to the prison guard, I need this handcuff removed. That way that I'm able to better assess and thoroughly assess this patient. She also advocated for herself and myself, so she functioned as a nurse advocate. She said to the prison guard that he needed to stay in the room during the patient assessment. He couldn't leave because that would compromise her safety. So her role as a change agent was really prominent because, as she said, some nurses might have just kept the patient shackled and done a mediocre assessment, but it was really important to her to do a thorough assessment for this patient. So objective 6, formulate plans for continued personal leadership, growth, and development as an independent practitioner of nursing and contributing member of society. So I did this through my continuing education. The Student Nurses Association had the director of the Burn, Trauma, and Neuro ICU at Lehigh Valley Cedar Crest come in and talk to us, and some of her accomplishments aligned with some of my goals after graduating with my BSN. So this nurse was a Cedar Crest emergency room nurse for over 10 years, and she was also a Cedar Crest College BSN graduate. And she explained how her education and her work ethic assisted her in gaining positions as a charge nurse, a patient coordinator, and eventually a director at Lehigh Valley Health Network. So I also have goals to become a family nurse practitioner after graduating with my bachelor's. So this really was helped me plan my future during shadowing Brian Weinberg, who is a doctor of nursing practice. So him and I had a discussion kind of how the medical field is transitioning from a master's of nursing practice to a doctor's of nursing practice for roles such as nurse anesthesia, and he was saying how he really thinks that nurse practitioners are going to be needing that doctorate level education in the future. So that really helped me kind of gain a better understanding of what kind of degree I want to try to pursue after graduating with my BSM. So I gained a really good sense of how to contribute as a member of society while my service leadership clinical. So I had volunteered at Feed the Children Teacher Store, which encompassed handing out school supplies to teachers so that way they could help kids in need. So I think that I really enjoyed this experience, and I think maybe it's something that I'll, once I have more time after I graduate with my BSN, I might try to find my way back to it. So objective 7, recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. So I did this through my political sessions. So I had Maureen Madden, who was a state representative, and she really talked about, COVID vaccinations and how nurses can really get involved and advocate for getting patients vaccinated and educating the public. And then I also had Matthew Muncy, who's Northampton County's Democratic chair, and so he advocated for nurses getting out there and speaking to political leaders. So part of his job was to find candidates, and he said, that if he speaks to nurses and can recognize their values and opinions, that he can better determine good political candidates. So really both of them said that nurses need to get out there and get out and express their political views and their values and find candidates that match up with that. So objective 8, predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So I accomplished this through my time at Patient Logistics. I learned how bed assignments work in a local health network, and this experience identified an ethical dilemma for me when bed assignments were so difficult for the nurse at Patient Logistics to accomplish. So this nurse explained the overwhelmingly low bed-to-patient ratio that was happening because of the COVID-19 pandemic. So she was explaining how some patients are going to less critical units when before the pandemic, some of them would have gone to intensive care units. So this can create an ethical dilemma with Provision 4 of the ANA Code of Ethics. The nurse has authority, accountability, responsibility for nursing practice, makes decisions, and takes actions consistent with the obligation to provide optimal patient care. So knowingly providing lower level care to these patients is not providing optimal care. So this is an ethical dilemma that I experienced in my clinical for nursing leadership. So that concludes my objectives. Thank you for listening, and I really enjoyed this experience.